Second time, I call the member for Maitland.
Thank you, Mr Acting Speaker. I rise to speak on the Health Practitioner Regulation National Law Amendment Review Bill 2016. And this bill, as we've heard, relates to various health professional councils and is designed to streamline the complaints handling processes in New South Wales, and it is nothing more than a tidy up. But in a system where health complaints have risen by 10.5% from 2013 to 2014, to 2014 and 15, by more than 5,000 complaints, we need much more than a tidy up. What we need is more resourcing desperately for this system. The Baird government slashed $3 billion from the health system, and the Turnbull federal government has added even more cuts with its $17.1 billion cuts. So there are now over 20 billion reasons for this government to improve the health system, not just to streamline the complaints process, but to actually stop those complaints from happening. And these complaints, Mr Acting Speaker, are not made to be vexatious. They are real people who have real and genuine concerns when they see the impact of the cuts on them directly on their health care. And again, it's not the people who provide that care who are at fault. What more can they do? Earlier today in this place, the question was asked about what the state government has done to improve our nation. What have they done? What have they done to our national economy? They've done nothing, and they've just sat there while the federal government has ripped out nearly $20 billion out of the health system with their $17.1 billion, and they've added the $3 billion there to make it a neat 20. Our system is under stress. I have a community where the hospital that is trying to service over 75,000 people, plus all the other regional people that live in my community, has just 188 beds. The planned hospital that was promised back in 2010, before the last election, was originally promised to be a 750-bed hospital, and after all the cuts that this government has introduced, they are now saying that it will probably be less than 315. Before my election, I've spoken to the Medical Council of Doctors at Maitland, and they expressed to me their very grave concerns, not about what will happen when the new hospital is built, whether that will be the capacity, but how do they get from a 188-bed hospital to one that may be just over 300 beds. What do they do in the meantime to get from here to there? And as every day goes by in my community where that hospital is not built, there are people who are struggling with health services who need urgent medical attention, surgery, they need medical procedures of all sorts done, and they're not able to get it done in that hospital because there are not enough beds. And so they have to be able to get from here to there. They need those beds to become available, and they can't come, Mr Acting Speaker, in an environment where we've seen the cuts that we've seen. I've had doctors come up to me and say the $400 million that the government's promised for the hospital is totally inadequate. They need an $800 million hospital. They need new resources. They need to have ability for cancer patients to actually go and get chemotherapy in Maitland, in a town of 75,000 people. To not be able to get chemotherapy and radiation treatment is appalling in this day and age. And Mr Acting Speaker, we really need to think about the impact that this is going to have for all the comorbidities that have an impact in health. So when you have diabetics who can't get proper treatment, who aren't able to get surgeries they need, it becomes, the longer the waiting list, the worse the health outcomes are for them. And even things like knee replacements, you know, if you've got someone who's an elderly person who needs a knee replacement and they don't do it, what happens? They limit their physical mobility. What does that mean? They put on weight, they become subject to other diseases such as heart disease, diabetes, high cholesterol and stroke and all these other diseases that we know that are related to obesity, because simply they can't get on a list to get a knee replacement. Our private hospital in East Maitland is going ahead by leaps and bounds. It's creating all sorts of infrastructure problems for our community, with parking, with access to buildings, etc., because there is just a simple lack of public facilities. And what the government needs to do is actually put the money into health and put it into the communities like mine, which are growing by 5 people a day, so that we can actually help the people of Maitland, help the people more generally in our health system across this state. you might be interested to know, Madam Temporary Speaker, that yesterday I was actually at the opening of a shopping centre in my electorate where a private investor is going to spend $372 million to extend a shopping centre so that people in my electorate and in our region can have access to DJs. But my concern is how does the government justify that if a private investor can put $372 million in there to extend a shopping centre, how can they not spend the rest of the $400 million that they have promised to my electorate for 5 years to build a hospital? That just seems to me crazy. Like, they want us to go shopping, but they don't want us to get healthy. Where's the priorities? So nurses, doctors, and ancillary staff in my community deserve to have the public hospital, the fully public hospital that the government promised to them, the $400 million that they were going to spend on that hospital. Public. And that's what we want. No more of these little debacles like you had up in Port Macquarie with the PPPs that are real fancy until the private sector walks away. So we need to get back to really what is the issue here. We need more resources. And the people on that side of the House, Mrs. Temporary Speaker, Madam Temporary Speaker, will tell you that they want to get into private delivery of health services, and what a shame that this government won't back our community and ensure that we have the resources that we need to deliver health outcomes for every person who lives in New South Wales. And I do support this bill, but I say it doesn't go far enough, and you can't just tinker at the edges and streamline a complaints process so that you can not have to deal with 5,000 extra complaints in 1 year. That's not the point. The point should be resourcing adequately the health system, and that is what this government has failed comprehensively to do. So the nurses and doctors, the ancillary staff in our hospitals are under massive pressure. Many of the practitioner managers, so the nurse managers, the physio managers, the psychology managers, all the specialist ancillary services as well as the nurses, have been taken away from frontline service delivery because they've been trying to cut more cost into this. And what does that mean? They have to undertake more management duties without the ability to deliver on the highly complex and specialised expertise that is required from them from our health system. We've got more people behind computers and less people in front of patients, and that's not the sample of a good public health system. And we need to look at bed block. We need to ensure that when the beds get filled, when we have code reds like we've had at Maitland, where everyone in the hospital has to drop their what they're doing and rush to the emergency because there are no more spaces in that space, and we need to get people seen urgently. We need to make sure that these bed blocks that are rising aren't just fixed by people being shunted out before they're ready, that they don't go home on Friday and come back on Monday and stay even longer, which is what we're hearing evidence of in our electorates. So I'm really concerned about the health system in New South Wales, and yes, I want complaints to be dealt with more effectively and more efficiently. I think looking at things like an audio recording of proceedings, just like it does for domestic violence victims, to have more of that audio space so people can actually hear the pain and the suffering that these people have been having to experience because of the lack of investment in health by this government. I think that's really important because you can't get that in a transcript. I think it's really important. I think we also need to make sure that we look at what we're going to reverse, that we can reverse some of these cuts. So it's things like the changes that are going to come into charges for vital tests like x-rays, blood and urine tests, ultrasounds, MRIs and pap smears. So a whole generation of fantastic preventative medication that is saving lives will now cost money, and we know what the net outcome of that is, shifting it from the government's pocket into the community's pocket. We know that we will be paying the price, and our children will be paying the price of that delayed expenditure, because people will not go to the hospital and they will hold on until it is too late to help them and treat them. The summary of the New South Wales health system under this government is waiting. Patients wait at every stage. They wait for an ambulance, they wait outside emergency departments, they wait inside the emergency departments, and they wait for a bed. Wait, wait, wait.
This time has expired.